Hi, everyone. My name is Dafina Melbourne, and I work with maternal, paternal, child, and adolescent health in Alameda County. And I want to share with you all why I encouraged my son and my daughter in love to be vaccinated. I am a new grandmother. My grandbaby is 9 months old. And when she was born, neither of her parents were vaccinated, and they didn't get vaccinated until she was about 6 months old. And so I had conversations with them about the efficacy of the vaccine, the trials, tried to answer some of their questions around their fears and concerns, but also wanted to honor their choices and their bodily autonomy. And so I know sometimes it can be difficult to talk to people in our community and people in our family about being vaccinated. But I wanted to bring home to them some of the things that I thought they could potentially miss out on if they weren't vaccinated. And a couple of those things was seeing their daughters grow up and graduate from high school, being able to be there for all those special moments like their first steps and their first date and graduating from college and just being there to help them navigate life. And my fear and concern was that should they not become vaccinated, that was a real possibility. And I also was concerned because my granddaughters are both under the age of vaccination. And so I know that there are increased risks for one of my daughters or granddaughters, because she has asthma, and my new grandbaby is only 9 months, and we know that infants cannot currently be vaccinated from COVID. And so I really wanted to bring it home to them also that, by getting vaccinated, they were protecting their daughters from potentially being exposed to COVID, always being gentle. And eventually they decided that they did want to become vaccinated. But I approached them from a place of really thinking about those cherished memories that they want to have with their children and that I want to share with them and we want to share as a family, and how the risk of exposure to COVID and being hospitalized with COVID jeopardized all of those memories that we would have in the future. So I think because of that, they decided to become vaccinated because they didn't want to miss out on life's little and big moments that both of their daughters are going to have and currently are having now. So I hope that helps you to have those difficult conversations and just remember, if our family members are deciding not to be vaccinated, that we remind them of all the safety protocols they can take and put into place to ensure that they don't contract COVID, and that we can share holidays and time with them. Thank you.
From the California Department of Public Health, COVID-19 vaccine and pregnancy. Are you pregnant or planning to become pregnant? COVID-19 vaccines are safe and protective for you and your baby. If you are pregnant, you are at higher risk for severe COVID-19. Pregnant people are at higher risk for getting very sick with COVID-19 than people who are not pregnant. If you contract COVID-19, it may complicate your pregnancy. Pregnant people who contract COVID-19 are at higher risk for pregnancy complications, such as high blood pressure, bleeding disorders, death, and stillbirth. If you are pregnant, you may receive the COVID-19 vaccine. Pregnant and lactating people may receive any of the 3 COVID-19 vaccines currently authorized for use in the U.S. For more about vaccines currently available in California, visit our Get the Facts on Vaccines. The COVID-19 vaccine may provide your baby some protection from COVID-19. Recent studies show that vaccinated pregnant people pass antibodies to their developing baby in the womb, so the baby is born with some protection from day one. COVID-19 vaccines are effective. These vaccines use a small piece of the virus that can't cause infection, but triggers an immune response in the body, causing the body to produce protective antibodies. The vaccines do not contain live virus, so cannot give someone COVID-19 disease. All 3 vaccines are very protective. COVID-19 vaccines are safe for you and your baby. The CDC followed more than 35,000 people who were vaccinated during or just before pregnancy. Based on this information, and also based on what is known about how these vaccines work and their ingredients, researchers have found no obvious safety concerns for pregnant people receiving COVID-19 vaccine. Other considerations for vaccination during pregnancy. As with everyone who receives the COVID-19 vaccine, pregnant people may experience side effects such as body aches, chills, and tiredness. These are normal for everyone. Consult your doctor about any concerning side effects.
Hello, my name is Michael Spencer. I represent the Fatherhood Initiative of Alameda County Public Health Department. I'm here to encourage you all to take the vaccine. I am fully vaccinated, and it will help you if you do contract COVID-19, and it's better with it than without it.